Hey y'all, today I'm gonna film a little video about home health because I know there's a lot of people, a lot of nurses who have questions about home health because people do want to try different types of nursing other than just hospital nursing, and home health is one of those things that people would like to try but they're afraid. So I was going to talk a little bit about home health, and then I was going to do a little walk down the Madisonville riverfront. So right now I'm sitting in my car because it's so hot and it's busy out here today. It's so crowded. Here, I'll turn the phone around. See, look at this beautiful place. This is Madisonville, Louisiana. And we'll walk out there a little ways in a minute. But first I wanted to go over some of the stuff about home health. The first thing is I was gonna just quickly do 3 pros and 3 cons, and those are the absolute top things that I can think of to let you know if you're thinking of trying to get out of the hospital type nursing environment and go to something else. So the start, of course, with the good stuff about home health. Number 1 is the pay. I think you can make, in my experience, you can make more money working in home health than you can in a hospital because you have a lot more control over your schedule and what you do. So some agencies still have pay per visit. So if you're real fast, you can get a bunch of visits done and you can make a killing. I used to make a killing doing the pay per visit. You can get burned out real quick because it's like, you know, they pay pretty well. I mean, for an admission, they'll pay you $130. I think that's the rate now. So you can make a lot more money and kind of make your own schedule. So really, that would be number 2 is your schedule. It's usually 5 8-hour days. You pick when you start and you finish when you finish. Patients don't generally want you to come at 7 a.m. Matter of fact, they won't let you. So if you want to start at 9 or 10 in the morning, patients are happy with that, but you're going to, and get everything done. I actually try to start early, 8:30. And then I try to get home by 3 so that I can do the charting, because that's going to be in the cons, is all the charting. But yeah, so that's 2 of the biggies right there. I would say schedule, flexibility, because I used to, when my kids were young, I used to drop my kids at school and go see some patients and then go pick them up, and then after I fed them and while they were playing or whatever, then I would finish my charting, and so it was really good. So those are the 2 biggies. The third one I would say is the patients themselves, because home health has great patients usually. Some of them are very complex, and there are always those bad patients. I'm just going to be honest with you. There's always bad patients. There's bad patients everywhere. But, they're having you come into their home, and they're referred by the doctor a lot of times, although unfortunately now hospitals don't have anything to do with some patients, and they just dump them into home health just to have something to do with them. But a lot of them are referred by doctors' offices, and they're generally 65 years or older, and Medicare, some Medicare Advantage, mostly Medicare Advantage, a lot of teaching on disease processes. So great patients. I've learned so much from them. I love my patients, and I wouldn't do anything else really. I can't say there's any better patients in all the areas I've worked. I'm trying to think of a better group of patients, and there's not really. The seniors, 65 or older, are the best. They are. So now real quick for the cons, for the bad stuff. And so obviously people are going to say safety. I personally have not felt like safety is a con. I have not felt unsafe in anybody's home, other than maybe a couple times, and it wasn't because of the patient, it was because of a dog that was, you know, an aggressive breed, and the patient put the dog up or whatever. But that's the only time I've really felt unsafe. I've not felt unsafe with a patient. They're generally in their 80s, you know, they're 65 or older. I've had some in like nursing facilities, they're assisted living, you know, that were kind of cuckoo and, you know, made some inappropriate comment, but I just, you know, just said, listen, that's inappropriate, and if you say anything like that again, you're going to get a male nurse and I won't come back. And I've never had the problem again with them. So yeah, I haven't felt like, I mean, I have never been, nothing's ever happened. Now, I did have a coworker who recently, young, cute little coworker, tiny little thing, little nurse, a patient kissed her on the lips, and she was new to home health, and she quit because she was like, you know, I'm scared to, you know, that more things are going to happen. I've never had that happen. So, I mean, most people are not, you're not seeing them by themselves. Usually there's family member or caregivers. So, you know, you have to use your judgment. They always say that. I do carry pepper spray, but I've never even thought about using it. I mean, the most, like I said, that I've wanted to use it is for a dog. So safety is a negative. The other negative, I would say, it's not even, it's the biggest negative that you need to realize when you go into home health nursing is the charting. We have to do this Medicare assessment, which is basically called an OASIS, for admissions, discharges, recertifications, and resumptions of care, and they are long, and it can take you a long time to do them. And they're not only, this is another negative about it, they're not only an assessment for nursing, they're also a payment tool for the company. So the company gets reimbursed based on what the nurse puts. So there's a little bit of, sometimes in some agencies, there's a little bit of pressure, you know, to change your answers. There's a whole QR team that goes over every OASIS and changes your answers. I haven't found that it's really fraudulent in most cases. It's basically whenever you talk to the QR people, they have reasons why they want to change it. And to be honest, the nurse has to agree to the changes. And I, 90% of the time, agree with, you know, if I have questions, I'll call the QR people. But 90% of the time, I agree. And that's that. So, but that long OASIS, you have to be quick. And so your assessment skills have to be really good so that you're not sitting there. You've got to, you know, it takes a long time to learn home health nursing. So that's why the pay is a little better. And the pay is better in traveling also, I'll just tell you, because they don't have a lot of home health nurses that have been trained to do this. And if you don't know what you're doing, it's going to take you a long time, and you're not going to last in home health. You have to be fast, and you have to have really good assessment skills, and you have to have really good nursing skills, because you're going into somebody's home and there's nobody there to help you, right? You're on your own. If you can't get the lab, if you can't do the whatever, there's nobody, you're not going to get somebody to come stick them again for you. So if you have good skills, and you know, by all means. If you don't, if for some reason you get in the home and you can't get, say, a lab, it's not, they can go to the lab. I mean, it used to be more pressure on nurses and stuff to do these skills in the home, but I'll be honest, Medicare decided that drawing labs is not a skilled need anymore. So they don't pay nurses to go out and draw your labs. We used to do a lot of labs. We don't do so many anymore, just for that reason, because we have to be going for another reason. There has to be a skilled need, and I can go into more training, I mean, stuff about home health, more details about it, but so you're not going to go out there and do a lot of labs anyway if that's not your thing. You can still do home health, but you do need to have been a nurse. And that's another negative, is that you can't just, you know, come out of nursing school and say, oh, I'm going to be a home health nurse. You're not. You have to work in the hospital for at least a year, maybe longer, and really get your disease processes, teaching skills down, because that's mainly what we do. We're teaching people to deal with diabetes and congestive heart failure and COPD, and also safety. They just got oxygen, how not to blow themselves up. I have had about 4 patients blow themselves up, just so you know, because they don't listen. But so those are some negatives right there. Another one I think is a negative. For me, it's a negative. It used to be a positive, but now it's a negative, is all the driving. The driving to me is really a negative, because I hate traffic, and the traffic is worse than ever. And I'm just tired of driving. I've been driving so long. I've been doing home health off and on for about 24 years. That's a long time. Off and on. So in all, I'd say about 20 years that I really probably have of experience in home health. So after all that time, I'm tired of driving. But they do pay you. The home health companies will pay you to per mile. Some you make a lot of money on your mileage. I mean, if you get the GSA rate, which is what I'm getting for my travel contract, right? I'm making a little money, but when you have to buy a new car, it all comes out in the wash. So you do put a lot of miles on your car. So those are some of the negatives. I do highly recommend home health for you to try it. It will, if you're going to do home health, it will take you a good 2 to 3 months of orientation. And I'm not just saying that. You really have to learn how to do the OASIS correctly. It's not, it's not a cut and dried assessment tool. And if you don't do it right, they're going to be sending them back to you. It's going to take you more time. It has a lot to do, unfortunately, with payment, and also how much that the patient will get. How many visits they're going to get from their insurance company, because they're going to look at what you put, and if you put that they're not that sick, the insurance company's going to say, well, we're not going to give them any visits. They're not sick. What do they need a nurse for? So really, I highly do suggest it, though, especially for you nurses who've been a nurse a long time and you've worked in the hospital and you're done, and you've been, busting your butt for 12-hour shifts and working weekends and nights and all this stuff. Home health is ideal for you, because especially, now you're getting 40, 50, 60 years old. Your body can't take that anymore. All the standing and the walking and stuff, and you don't have that in home health. You don't. You are driving, but you're not lifting people. You're not transferring people. You're not bathing people. You're not doing any of that stuff. So if you guys want me to talk more about home health and the particulars of what you actually do in a typical home health day, just make a comment and I'll do that. I'm just not sure that a whole lot of people want to know about a particular day. I was just wanting to tell you the pros and cons from, just the main points. So any questions, just let me know, and I'd be happy to review it. Anyway, you guys have a great day. I'm going to walk down this little lakefront, and I'll video it because it's so beautiful. You guys can't miss it. And catch you on the next video.